Robin Kesno, RVT, founder of Animal RN. Today I just want to go a little bit deeper into some questions that you can ask your pharmacist and or your veterinarian if you are one of the people affected by the new changes in FDA regulations for your pet's prescriptions. What they did is they shortened the expiration date, so they can no longer give you a 30-day supply at one time. They can only give you 14 days at maximum. Now, what does that mean? So we already talked about in another video, like I said, we'll just quickly recap here, just link to it, that's going to drive up your cost for formulating the medication. Instead of doing it once a month, you're going to have to do it twice. Even though you're using less material and less medication, the doctor, the pharmacist, still has to do their work twice in 1 month. So that's going to drive up your costs. And that's not even counting if you're having it shipped to you. Now you have to pay for having it mailed twice. If you're going to get it, you have to get over there and get it twice. You have to have the time and the energy to call in the prescription. You have to do it in a way that you're not running out of medication and yet you're not over getting it. Lots of drama there. Okay, now let's go into the alternatives and what questions you can ask your veterinarian and or your pharmacist so that you can deal with this the best way for your baby, so we're not compromising healthcare because of these regulations. First, let me just say the regulations aren't a bad idea. It is very, very rare, but I will not lie. Anecdotally, myself, I have seen sometimes where I have questioned the efficacy of a medication at the end of a larger bottle, especially of something that's a super small dose and it's meant to be a 30-day supply, but because it's PRN or every 48 to 72 hours, we're really stretching that prescription sometimes. At the end of that bottle, even though it's technically inside of its expiration date, sometimes I'm not quite sure it's working the way it should. Sometimes we've seen breakthrough seizures on those on anti-seizure medications. We've seen appetite stimulants not seem to have the same effect they did earlier. And this is very anecdotal. There's no evidence that I have to support that. This is just, I've seen it, and if I'm in doubt and we're near the end of the bottle, we just get another bottle and we go from there. So I'm not against this change, but it does complicate things. I think the answer is some research by the drug medications so that they can say, okay, for this med, for this med, for this, here's how we can formulate it in a way that keeps it stable. In the meantime, we have this blanketed 14-day maximum on anything in water. What is the pharmacist going to do? So the first option is that they're going to tell you, okay, we can do the 14 days, we'll keep everything as it is, but now you have to come in twice in 1 month to get the same thing. We talked about in the other video about that. Now, the other option they might offer you, because pharmacists understand the pet care costs, the challenge of having to call in the prescription, know when it's ready, get there within their hours, or have it shipped, or paying to have it shipped twice. They understand, they feel your pain. And so one of the solutions they can offer you right away is oil. Now, I have one little challenge, maybe two challenges with the oil. This is not a healthy 100% rockin' body that we're putting medicine in. If it was, it wouldn't be on medication. So what kind of oil are we using? Because cats and dogs, their body mass, especially if they're senior, especially if they're, in my world, it's hospice all the time. So they are very fragile little beings. The oil could seriously upset the GI tract. It could seriously upset some balances that we have going on or we're trying to get rebalanced of. So oil can be problematic. It could also be fine. So it just depends on the particular animal and the type of oil. So what kind of oil are they going to suspend it in? Then we have to check in with the veterinarian or with a hospice nurse, somebody who knows our animal, knows the situation, and is qualified to say whether or not that amount of oil each day is going to negatively affect, or shoot, for that matter, in some animals, it could positively affect their health care. Okay, so we have the type of oil. What is the type of the oil? Now, the other challenge, and most pharmacists will be so sweet, they're so wonderful, and will address this for you. So all you have to do is ask the question, but we don't want to let the question go unasked. And that is it formulated differently? Because if you did an apples to apples formulaic change, when you give a water-based solution by, let's say, syringe, instead of a dropper, we're using a syringe to get the medicine out of the bottle and into the baby. Okay, so we have the syringe, we have the water-based solution. Darn near all of it, not even a micro drop, is left in that syringe. However, when we do oil, some of that residue is going to be in the bottle, so we want to make sure the formula is adjusted if necessary. Now, if we have larger dosing and we have a larger animal, this is less of a big deal. But when we're doing microdosing already with, for example, small cats and anti-seizure medication, sometimes if we can change the diet, we can reduce the need for medication. We reduce the need for medication. We're doing microdosing, just enough to top the body off from its natural levels of phenobarbital, for example. When you're doing that level of microdosing, if you don't get out every drop of medicine into the baby, it's going to be a problem. And yet not all of them are going to be that fine-tuned. So making sure, what is the oil? And then the next one, does the dosing need to be adjusted based on my route of administration and my particular animal, their body weight, the medication needs, all of those things. This is different again than if it was a human. This is not a 200-pound or 180-pound person. This is not even a 90-pound person. This is a baby. Sometimes they're little, weak, old babies. We cannot be messing with their meds. Not the ones I work with in hospice, right? Okay, so what is the oil, and does the formula need to be changed? And the other thing that I'm going to really highly recommend, this is going to be more a question for your veterinarian than your pharmacist, and that is, should we be looking at different delivery routes for the same medication or a different medication at this point? Because it might have been cost effective to do this, and if we decide that the water-based solution is the best, keeping it every 2 weeks is the best, or that the microdosing or the oil will negatively affect our baby, it might be that there's a better solution. It could also be, too, that our animals have changed. Maybe you weren't giving a pill because your animal doesn't tolerate pill pockets. Maybe they will today. Maybe they didn't have... they weren't used to being handled as much because they were young and healthy and you first started the medicine and the liquid was the only thing that you could get to work. But maybe now that it's been years of them being on medication and they're used to being handled, they've come to trust that you're not trying to kill them, you're just getting in a little liquid. Maybe now they could tolerate a pill. So definitely touch base with your veterinarian. So we can change it back to a pill, for example. We can change it to, depending on the medicine, different solutions, injectables, ears. I mean, we got options, people. We got options. So checking in with your veterinarian to see, is this in fact still the right fit for us as a family and for your baby? I'm Robin Kesno, the RVT with TLC. This has been your tip for the day. Have a wonderful one. And if you have any questions about the changes in FDA regulations, first of all, I'm going to direct you to your pharmacist because they are amazing rock star people and they are my world. Compounding pharmacists are my heroes. And then I'm going to direct you to your veterinarian, and of course you can always contact me, Robin at animalrn.com. Thank you.